Cri-du-Chat syndrome is a genetic chromosomal disorder. Look at this picture shows that. And CT scan and MRI to assess brain structure. A detail going on. Introduction. Cri-du-Chat syndrome, also known as 5p deletion syndrome, is a rare genetic disorder resulting from the deletion of genetic material on the short arm of chromosome 5. The name of the syndrome, which means cry of the cat, is French, come from the characteristic high pitched cry of affected infants, which resembles the mewing of a cat. The syndrome was first described by Jerome Lejeune in 1963. Definition: Cri-du-Chat syndrome is a congenital chromosomal disorder caused by a partial deletion of short arm P of chromosome 5, particularly in the region designated 5p152, characterized by the disorder is characterized by 1. A cat-like cry in infancy. 2. Distinctive facial features. 3. Growth retardation. 4. Mental and psychomotor delays. Etymology: the term cri-du-chat is French for cry of the cat, referring to the characteristic high-pitched cat-like cry of affected infants. It was first described and named by French geneticist Jerome Lejeune in 1963. Epidemiology: Cri-du-Chat syndrome occurred in approximately 1 in 20,000 to 50,000 live births worldwide. It affects females slightly more often than males. Ratio 4:3, and accounts for around 1% of all cases of intellectual disability with known chromosomal abnormalities. Most cases arise from de novo deletion, with only about 10 to 15% linked to a parental chromosomal rearrangement. Types: there are no standard clinical types, but the syndrome can be categorized genetically. 1. Terminal deletion, loss of the end protein of 5p. 2. external deletion. Deletion occurs in the middle section of 5p. 3. Mosaicism. Some cells have the deletion and others are normal. 4. Unbalanced translocation, chromosomal rearrangement involving chromosome 5 and another chromosome leading to extra or missing genetic material. Severity of symptoms often depends on size and location of the deletion. Causes: 1. De novo deletion of chromosome 5p, 90% of cases not inherited, occurs randomly during gamete formation or early embryonic development. 2. Parental chromosomal rearrangement, 10% of cases, often due to balanced translocation in a parent that leads to an unbalanced chromosomal complement in the child. Risk factors: 1. Parental balance translocation. 2. Advanced parental age, especially paternal. 3. Family history of chromosomal abnormalities. 4. Consanguinity, increased risk in communities with interfamily marriage. Complications: 1. Severe intellectual disability. 2. Delayed or absent speech development. 3. Feeding difficulties leading to failure to thrive. 4. Recurrent respiratory infections. 5. Scoliosis and other orthopedic issues. 6. Self-injurious behavior. 7. Seizures in some cases. 8. Behavioral problems like hyperactivity and aggression. Pathophysiology. Pathophysiology of CRI syndrome, step-by-step process. The pathophysiology of CRI syndrome involves a genetic deletion that disrupts normal development, especially in the nervous system, muscles, and facial structures. Step 1. Chromosomal deletion. A partial deletion occurs on the short arm of chromosome 5, region 5p15. This deletion can happen sporadically, most commonly, or be inherited from parent with balanced translocation. Step 2. Loss of critical genes. The deletion leads to the loss of several important genes, includes CTNND2, involved in neural development and learning, SCMA5A, involved in axon guidance, and brain wiring. TRT, telomerase reverse transcriptase, important in cell division and aging. The larger the deletion, the more severe the symptoms. Step 3, abnormal neurodevelopment. Loss of CTNND2 and SCMA5A disturbs brain development, especially the cerebral cortex. Synapse formation leading to intellectual disability and motor delays. Delayed or abnormal myelination of nerves causes poor motor coordination and muscle hypotonia. Step 4, malformation of the larynx. Structural defects in the larynx and surrounding cartilage leads to the characteristic high-pitched cat-like cry in infants. This may resolve with age as the larynx matures. Step 5, impaired physical and facial development. Disruption of genes and responsible for craniofacial development causes microcephaly, microgenitia, wide set eyes, and low set ears. These contribute to the distinctive facial features of affected children. Step 6, global developmental delay. Intellectual disability arises from abnormal neural connections and reduced brain volume. The child experiences delayed speech and motor milestones, poor muscle tone and coordination, limited language development or complete absence of speech. Step 7, secondary complications. Additional complications may develop over time, such as feeding problems due to poor suck swallowing coordination, respiratory infections due to low immunity or aspiration, behavioral issues like hyperactivity, aggression, or repetitive movements. Signs and symptoms. A. In infants, high pitched cat like cry, low birth weight, hypotonia, floppy baby, microcephaly, poor sucking and feeding. B. Facial features, round face, hyper telorism, wide spread eyes, low set ears, epicanthial folds, microgenitia, small jaw, C. Developmental and behavioral symptoms. Severe developmental delay, intellectual disability, poor motor coordination, delayed speech or nonverbal, behavioral problems, hyperactivity, repetitive movements. Diagnosis. A. Prenatal diagnosis. 1. Chromosomal loose sampling CVS. 2. Amniocentesis. 3. Detected via karyotyping or fluorescence in soot. Hybridization. FISH. B. Postnatal diagnosis. 1. Clinical observation of symptoms, CRI, facial features. 2. Cytogenetic analysis. 3. FISH or microarray analysis for confirming deletion. 4. MRI CT scan to assess brain structure. Nursing diagnosis. 1. Impaired verbal communication related to developmental delay. 2. Imbalanced nutrition less than body requirements due to feeding difficulties. 3. Delayed growth and development. 4. Impaired physical mobility related to hypotonia. 5. Caregiver role strain due to long-term care demands. Medical management. 1. No cure, symptomatic and supportive care only. 2. Multidisciplinary team, pediatrician, neurologist, geneticist, therapist. 3. Feeding support, NG tube, dietitians. 4. Seizures management if needed. 5. Orthopedic management for scoliosis or other deformities. Nursing management. 1. Monitor growth and developmental milestones. 2. Assist with feeding techniques. 3. Encourage therapies, physical, speech, occupational. 4. Provide emotional support to families. 5. Educate parents on safety and home care. 6. Coordinate care across healthcare settings. Treatment options. 1. Early intervention programs. 2. Speech therapy to improve communication. 3. Occupational therapy for motor skills. 4. Physical therapy to improve tones and mobility. 5. Behavioral therapy for managing conduct issues. 6. Surgical correction of physical abnormalities if needed. 7. Educational support with individualized education plans. Psychosocial medicine. 1. Parental support and counseling help families understand and cope with the diagnosis. 2. Support groups connecting parents with others for emotional and practical support. 3. Community integration programs, social skill building and peer engagement activities. 4. Special education services, tailored programs in inclusive or specialized setting. 5. Respite care services, providing temporary relief for caregivers to reduce burnout. Prevention. 1. Genetic counseling for at-risk couples. 2. Prenatal testing in pregnancies with risk factors. 3. Avoidance of known environmental mutagens during pregnancy. 4. Family planning options using pre-implantation genetic diagnosis (PGD). In conclusion, CRI syndrome is a rare but severe chromosomal disorder with distinct features and lifelong implications. Though it has no cure, early intervention, therapeutic support, and tailored educational programs can significantly enhance the quality of life for affected individuals. With appropriate medical care, nursing support, and psychosocial services, families can be empowered to manage the challenges of this condition and help children reach their maximum potential. Thank you. Have a nice day.